All right, 7 minutes past 10 from Women Radio 91.7, Nigeria's first and only radio station for women and their families. Glad to know that you're still there on that other side, tuned into WFM 91.7. It's a new month, so how are you doing today? Being the first day in the month of November 2024. I really do hope that your day started off for you on a great note, regardless of how your day started off. This is to remind you that there is always light at the end of the tunnel. And I also hope that you're taking care of yourself mentally, physically, medically, in all areas. My name is Blessing Agbeta. Thank you very much for joining me today on Radio Doctor. Radio Doctor is a free health consultation program where medical doctors consult for free and advise on women radio. Radio Doctor is Nigeria's first specialized radio health program where medical doctors advise real people. It is broadcast 10 a.m. through to 11 a.m. Mondays through to Fridays. And of course, my name is Blessing Agbeta. Our radio doctor for today is Dr. Abiola Ajayi, the CEO of ROA Specialist Hospital. Good to have you on the show today, Dr. Abiola.
Good morning, Blessing. Can you hear me?
Good morning, I can hear you. Good morning. Happy New Month to you.
Happy New Month. I'm just saying that.
All right. Good to have you on the show today. All right, so on Radio Doctor today, Dr. Abiola Ajayi, the MD of ROA Specialist Hospital, will be consulting and advising on antenatal classes, early education for a healthier pregnancy journey. Now, the phone lines will be open 07000 917 917 or 800 1235 917, and of course 0703 175 6537. That is how you can be a part of the conversation for today. Now remember that at the end of the program we'll be giving out Dr. Abiola's number so you can reach out to him for further consultation. However, if you have any question about us on pregnancy, or let me say pregnancy related question, do well to reach out to us on the show for today. Okay, so let's delve into the conversation already. Antenatal classes, early education for a healthier pregnancy journey. Now, Dr. Abiola, I would like us to start the conversation this way. What would you refer to as antenatal classes, and then why are they important for expectant mothers or pregnant women, as the case may be?
Antenatal classes are organized educational sessions for pregnant women that usually focus on pregnancy, childbirth, and even early parenting skills. The aim of these classes is to inform expectant mothers about their pregnancy stages, how to navigate the labor process, and some postnatal care or after delivery care, and gives them the chance to make informed decisions. Why is this important? In Nigeria, the maternal mortality rate, that's how many mothers died during childbirth, is the highest, is among the highest in the world. It's about 500 and over 500 deaths per every 100,000 live births. That's from a research study done in 2020. So the knowledge from these antenatal classes is crucial to not only reduce maternal deaths, but also reduce infant death and infant mortality, and also to reduce morbidity, which is sickness related to a disease state. So some of the studies show that women who attend these classes are definitely more likely to seek skilled delivery services, meaning, with a midwife, a doctor, a hospital, and it significantly reduces the complications of childbirth and for the mother. And there's a tertiary benefit of emotional support that you can gain from these classes, because we're taking them with other pregnant women and other women that may have delivered before. So the emotional support gained from these classes can reduce pregnancy-related anxiety, pregnancy-related hypertension or high blood pressure, depression, and something called postpartum depression, which I believe we talked about a few weeks ago. So all of those are benefited from attending these classes.
Mm-hmm. All right, thank you very, very much for your thoughts on the show for today. So, talking about antenatal classes, When should an expectant mother start attending antenatal classes?
Well, the literature suggests between 20 to 28 weeks to start, 20 to 28 weeks of pregnancy. Something about most pregnancies before 12 weeks, that's 12 weeks or 3 months, the pregnancy is pretty tenuous. It can drop. A lot of those pregnancies can end in miscarriage or what they call threatened abortion because of genetic abnormalities or one thing or another. But after 12 weeks, the pregnancy should be a little bit more stable. I tell my patients start taking classes at minimum at 12 weeks, but literature will say up to 20 to 28 weeks. Starting in the first trimester gives enough time to cover critical areas. Starting in the second trimester gives you enough time too, but starting later than that, you really may not have enough time because each class is going to cover a different topic. So it's especially valuable. It's especially valuable when we're talking about some of the complications of pregnancy, like preeclampsia, which can cause seizures and even death of both the mother and the child. Something called gestational diabetes, and oftentimes these, and third one, pregnancy-induced hypertension. So high blood pressure. All of these things will show up in that second trimester, or in that second trimester, and all three of them can really complicate a pregnancy and even cause death of the mother. So timely knowledge about recognizing symptoms and managing these conditions can prevent a lot of sickness and a lot of death.
All right, 07000 917 917. Send us a text and a WhatsApp message on 0703 175 6537. Log into our website www.thebfm917.com. Download the mobile app, the BFM 917. Sending your thoughts to our social media platforms, the BFM 917. That is how you can be a part of the conversation for today. What exactly would you like to say on the show? If you have questions, remember Dr. Abiola is here to provide answers to all of your questions. So 7000 917 917. Send us a text and a WhatsApp message on 0703 175 6537. Log on to our website at www.thebfm917.com. Download the mobile app WFM 917. Send your thoughts to our social media platforms WFM 917. 15 minutes past 10 from Women Radio 91.7, Nigeria's first and only radio station for women and their families. Glad to know that you're still there tuned into this dial. Thank you very, very much for choosing Women Radio WFM 91.7. This is Radio Doctor. Radio Doctor is that radio program where real doctors advise real people. Radio Doctor airs Mondays through to Fridays, 10 a.m. through to 11 a.m. because we're here to help us with our health. All right, today on the show we have Dr. Abiola Ajayi, the MDC of ROA Specialist Hospital, and of course on the show today is advising and consulting on antenatal classes, early education for a healthier pregnancy journey. And so far he has been able to establish the meaning of antenatal classes, what you need to know, why it is important for expectant mother. And of course, he has also been able to establish that it is important for pregnant women to register for antenatal classes between 20 to 28 weeks of being pregnant. Now, Dr. Abiola, I know that you've mentioned that antenatal classes are more like organized education session for pregnant women. So I would like you to know what kind of topics are usually covered in antenatal classes.
Well, they cover, and antenatal classes cover a range of topics. Some of the first ones, physical and emotional changes. So, especially for first-time mothers, understanding how your body is changing during pregnancy and how to manage pain and discomfort. I get a lot of women, especially towards the middle to the late part of the pregnancy, saying that, they have this crazy pain in the lower part of their belly, or they feel pain that comes and goes. And when somebody's talking about pain that comes and goes, if it's cramping that comes and goes, those may be early contractions. And if you can identify early contractions on time, there's some medications and things we can do to try and stop. That's what we call preterm labor or premature labor. So to know those symptoms and know that it's not just pain, there may be contractions, to know what discharge normal and abnormal looks like. These are extremely important topics. But we look at physical and emotional changes, we look at nutrition and health, emphasizing things like folic acid and iron. Folic acid, there's some research that shows that we should even be taking a double dose, especially in the first to second trimester.
Okay.
Folic acid reduces the chance of birth defects, especially what we call neural tube defects. So when you see these things like cleft lip, where there's a big space in the jaw, maybe upper or lower jaw, or cleft palate, there's so many different spina bifida, there's so many different neural tube defects that can be reduced by taking folic acid. Then in Nigeria, a condition called anemia, which we have a low blood level, is prevalent in almost 60% of pregnant women in Nigeria alone. So talking about iron supplementation, vitamin C, vitamin B, all those things are covered in the classes. Then labor and preparation for delivery. So like in our classes, we teach them how to get their delivery bag ready with all the things that you need. Talk about the stages of labor, how to push, how to breathe, and then how to manage pain during labor as well. And then finally, postpartum, meaning after delivery, and newborn care. You'd be surprised at how many mothers need instruction on how to get the baby to suck milk, how to clean the navel. So many things are covered. So many things like that are covered in these classes. And they provide mothers with a well-rounded knowledge, especially if it's done in like a healthcare facility where you can see very, very good resources.
All right, 07000 917 917. I hear you. You've mentioned some of the things that we get to benefit, pregnant women get to benefit, talking about the nutrition and health, the physical and emotional changes, conversations, and then what pregnant women need to know postpartum. Now, let's talk about these antenatal classes for a moment. How do these classes benefit overall health of both the mother and the baby? Because for some people, they would gladly skip their antenatal classes. So is there anything to know about how it is beneficial to them and their children? Maybe when they know, and of course maybe they would have a rethink about taking the antenatal classes serious. I also have another question, or maybe I should allow you answer that, and then before I bring up that, it was going to take you a step backward, not take you a step backward, but just take you back to your answer. Right, when you said something about folic acid, I have heard some people say that before you get pregnant, you can take folic acid, but at the moment you get pregnant, you stop taking folic acid. So I would like you to touch on that as well.
That frightened me. No, that's absolutely terrible advice. When I have women trying to get pregnant, I put them on almost the same regimen, almost the same vitamins and minerals that I give women that are in the pregnancy. And when you get pregnant, not only do you continue taking folic acid, but typically increase it for at least the first 12 weeks. So times 2.
As against.
So I'm sorry.
I said as against 1 per day.
Yes, as against 1 per day. That's how I personally do it in my practice. But going the opposite way, stopping folic acid when you get pregnant, that would be a no-no, an absolute no-no.
Okay.
Good one.
Okay. So, still
we're talking about the benefit now.
Before you move on, Dr. Abiola, still on the folic acid. So, if you take folic acid, first 3 months you said within the first 12 weeks, that's the first 3 months, and then you increase the dosage. As against taking 1 pre-pregnancy, now you're pregnant, you're taking 2 dosage per day. Are you going to switch back to the other months? Say you're in your second trimester, are you going to switch back to taking 1 per day, or you're going to stop totally?
Yeah, so let me be clear.
So is there any time you get to stop taking it?
Well, it's so let's use figures. Typically, 1 dose of folic acid, 1 tablet, is 400 micrograms. So we're going to take 800 micrograms or 2 doses through the first trimester. So that's the first 12 weeks. the 13th week is safe to go back to the 400 micrograms or one tablet.
Okay.
So as soon as you know you're pregnant, double it up to 800, two tablets, and then after 3 months, then you can go back to the one tablet.
Okay. Thank you very much. I mean, that answers it. So if you're pregnant and you're listening, I hope you have been able to note that down. And it is safe for you to use, okay? All right, let's get back to the benefit to the overall health of both the mother and the baby.
Yeah, so there are a couple of things to look at. We'll start with postpartum depression because we covered that topic before, and I'm sure they can find it on your guys' social media, the lecture on postpartum depression, which was very interesting. Postpartum depression affects about 15% of Nigerian mothers, which is quite significant. That's 1 in every 6 or 7 childbirths. So the antenatal classes provide mental health support. Just even being around like-minded people or being able to address some of your symptoms, sadness, depressed mood, etc., difficulty sleeping, you may find answers, if not amongst the women in the class, but amongst the instructors. Typically here we have our nurses and one of our doctors do the classes. So it's very important for postpartum depression. Another important category is to decrease the risk of malnutrition and possibly low birth weight. In Nigeria, the infant mortality rate, meaning how many children die in every 1,000 live births, is some of the highest in the entire world. So 56 for every 1,000 live births, infant dies. And in some areas, that number is higher. Right? So knowledge on infection prevention, proper feeding, neonatal care, meaning newborn care, is invaluable. There was a study done in Africa showing that mothers who attend antenatal classes are 40% less likely to experience severe complications during childbirth. So there's so many reasons there why the classes are beneficial. Reduce postpartum depression because that affects 15% of mothers. Reduce the infant mortality rate, which is now 56 in every 1,000 live births, and also reduce severe complications during childbirth by 42%.
All right, 07000 917 917. That is the number to call to be a part of the conversation. Send us a text and WhatsApp message on 0703 175 6537. Log on to our website at www.thebfm917.com. Download the mobile app, the BFM 917. Send your thoughts to our social media platforms, the WFM 917. That is how you can be a part of the conversation for today. What exactly would you like to say? If you have any question you would like to ask Dr. Abiola, whether you're a pregnant woman or you want to ask on behalf of your wife, this is the time for you to reach out to us on Radio Doctor. Now, Dr. Abiola, let's talk about this for a moment. What role does early education play in managing pregnancy-related discomforts?
I'm sorry, I don't hear you.
What role does early education play in managing pregnancy-related discomforts?
Yeah, early education is important to manage things like nausea, heartburn, reflux, and back pain. For example, especially in the early, let's say, first 18 weeks of pregnancy, there's lay people call morning sickness, right? In medical topic, we call it nausea and vomiting of pregnancy. Former term is hyperemesis gravidarum, which is a little bit more scary than nausea and vomiting of pregnancy. But there's some safe and simple dietary modifications and exercises that you can give that can help with things like nausea and heartburn. So instead of somebody taking, I won't name the name, but this popular antacid medication that can cause birth defects in women, you can learn ways of using honey and garlic and lemon and things like that to reduce nausea the safe way. And then it's also quite useful in areas that may not have access to different drugs. Then when you're having the back pain and the lower abdominal pain, you can be shown safe exercises and safe stretches that can help reduce that back strain. So just talking about pregnancy-related discomforts, it's quite valuable, the information you get from antenatal. Yes.
All right, 07000 Send us a text and WhatsApp message on 0703-175-6537. Log into our website at www.thebfm917.com. Download the mobile app, the BFM 917. Send your thoughts to our social media platforms, WFM 917. Dr. Abiola, are antenatal classes useful for first-time mothers only, or can experienced mothers also take advantage of antenatal classes? Like, once a mother, is it possible for you to always figure it out, or once a mother, you still, even though you're a mother, you still need to go to the hospital because every child is different, or every pregnancy is different?
Yeah, the simple answer is yes, they benefit both first-time and experienced mothers. Experienced mothers, of course, first time we've talked about the benefits, knowledge on pregnancy, childbirth, and knowledge on newborn care that you wouldn't have. Experienced mothers benefit because we update best practices in medicine all the time. Imagine if I continued to, I've started practicing in 2006. If I was practicing medicine the same way as when I finished training in 2006, now there's so many things that have changed, and I'd be really committing malpractice. So, for example, sleep position. We used to think that babies were meant to be put on their belly to sleep. Right now, and there was something called SIDS, or sudden infant death syndrome, that we now use that to discover that really the best position is babies should be put on their back. All this has changed within my career. Then there was something called cord clamping, when it was a common practice to, as soon as the baby comes out, you clamp and cut the umbilical cord. Now, when we know that delaying your cord clamping for up to a minute and or longer in some cases lets more blood transfer from the placenta to the newborn, which increases their iron levels increase their blood level and can give a large benefit to infant health. Even breastfeeding techniques have changed, right? And when we talk about pain management options, those are also always changing and improving, as well as interventions in labor. So what you do during labor, how you induce labor, how you even cut. The way we do something called episiotomy has changed. There's so many things that are updated. So you can't just think that, I've given birth before, I know everything. It's useful to get a refresher course in antenatal. That's for expectant or second and third time mothers. And then for the non-experienced or first time mothers, it's very important as well.
All right. So how do antenatal classes help in preparing for childbirth?
The statistics show that less than 50% of Nigerian women deliver in a healthcare facility. Right? The number is about 43% deliver in a healthcare facility, meaning that 57% deliver outside of a healthcare facility. These classes help prepare for childbirth by understanding the stages of labor. Labor isn't just a linear thing. There's what we call a latent phase or a slow phase, and there's an active phase or a faster phase, and all these things have times associated with them. You shouldn't stay in this stage of labor for too long, etc., etc. One of the, in preparing for childbirth, one of the things I see all the time, which is painful, is something called birth asphyxia or severe birth asphyxia, meaning the child, for some reason during childbirth, did not get enough oxygen. And the side effect of that is that the child might have brain damage or developmental delay. So you have a child that's 2 years old and is really acting like he's 8 months old. You have a child that's 5 years old, really acting like he's 2 years old. You have a child that's 10, really acting like they're only 5. Just developmental delay, and you can trace it all the way back to labor and delivery. So understanding that can possibly say, and there's no cure for that, by the way. When I see children like that, it hurts because it's going to be like that for life. There's some things you can do to improve them, but you can never turn them back. So, understanding labor stages, understanding even your pain management options, what you can and cannot do, are helpful in preparing for childbirth.
Hello, good morning. Hello, good morning. Hello. Okay, I'm struggling to hear you. You might just have to call us back on the show, okay? All right, 07000 917 917. 07000 917 917. That is the number to call to be a part of the conversation for today. 27 minutes right before 11 from Women Radio 91.7, Nigeria's first and only radio station for women and their families. Glad to know that you're still there tuned into this dial. And yes, if you are just joining us, you're listening to Radio Doctor. Radio Doctor is Nigeria's first consultation program where medical doctors consult for free and advise on Women Radio. It is broadcast 10 a.m. through to 11 a.m. on Women Radio WFM 91.7. And our Radio Doctor for today is Dr. Abiola Ajayi, the MD CEO of ROA Specialist Hospital. And today on the show, we are looking at the topic antenatal classes, early education for a healthier pregnancy journey. And Dr. Abiola has been able to do justice to what you need to understand about antenatal classes, why it is important for you as an expectant mother to attend antenatal classes. He has also been able to touch on the benefit of antenatal classes to not just you as a mother, but to your child, the child you're going to birth. So if you refuse to go for your antenatal, you're actually not only harming your child, you're also harming yourself. And we've been able to establish that it is important for you to register for your antenatal between 20 and 28 weeks of your pregnancy so that you can get early care. And we also established that for the antenatal classes, some of the topics that have been introduced cover the physical and emotional changes you get to experience as a pregnant woman, your nutrition and your health, and of course your postpartum, all of the things that comes after post-pregnancy. So yes, these are the conversations we've been able to have on the show for today. My name is Blessing Agbeto, and Dr. Abiola, I would like to ask you, can attending antenatal classes reduce the risk of pregnancy complications, and in what way?
Yes, antenatal classes help mothers with the knowledge to recognize early signs of complications, like preeclampsia and gestational diabetes, which I touched on earlier. In Nigeria, there was a study done showing access to obstetric care meaning pregnant care. And that study was done in 2018. And it showed that women who attend antenatal classes have a 30% less chance of severe pregnancy complications. When we talk about preeclampsia comes with high blood pressure, comes with something called protein in the urine, and it can progress to eclampsia, which involves seizures, uncontrollable seizures. I've witnessed this before. It's not pleasant. Uncontrollable seizures. And the blood pressure goes so high that at times the mother can pass away and take the baby with her. So understanding the signs, some of the signs, there's some early signs of preeclampsia that you shouldn't just ignore. Some of them as simple as leg swelling. So can you imagine if your legs, your feet swell, and you're only taking advice from the grandma around the corner, and she just tells you to put your feet up, right? But she doesn't tell you to check your urine for protein, check your blood pressure to make sure it's not going up, check your blood sugar, all those kind of things, and eventually you develop preeclampsia. Just like with almost all disease, catching something early is far better than catching it late. So preeclampsia, if we diagnose it early, see the woman's foot is swollen, I now check the urine, there's a little bit of protein in the urine. There's some things we can give and send her back home that same day. But if she comes in with, protein through the roof, BP through the roof, the legs swollen all the way up to the thigh, then we're going to admit her for IV treatment, and she may possibly spend a week, 2, or even a month in the hospital. And the chances of her dying or the baby dying, or even both, can go down exponentially if you're able to identify these signs, the early warning signs of some of these diseases. And the answer is yes, it can greatly reduce the chance of pregnancy complications.
All right.
There's some, sorry to interrupt you, there's some things that happen that may happen only in pregnancy and disappear. One of them is high blood pressure, and one of them is diabetes. So you can have pregnancy-induced high blood pressure. You can have gestational or pregnancy-induced diabetes, and those things can show up when you're pregnant, and they can disappear shortly after delivery. Just because you had one child and you didn't have these things doesn't mean the second child or second pregnancy will not involve that. And then vice versa, just because you had pregnancy-induced high blood pressure doesn't mean the second child will have it. That doesn't mean the second child may not have diabetes or any of these other complications. So it's important to attend the classes, understand the science, and do it for every pregnancy.
All right, 07000 917 917. That is the number to call to be a part of the conversation. Send us a text and WhatsApp message on 0703 175 6537. Log on to our website www.thebfm917.com. Download the mobile app, the BFM 917, sending your thoughts to our social media platforms, the WFM 917. That is how you can be a part of the conversation for today. Okay, so if you have any question, I see that you're trying to call in, but just keep your calls coming in, okay? So if you try and you're not able to connect, try as much as possible to send us a text, okay, so that you can actually ask Dr. Abiola your question. All right, so Dr. Abiola, what skills or techniques do mothers typically learn in these classes? I know that you've said so many things about the classes, about some of the things that they get to learn. Are there special skills or techniques that expectant mothers can learn during the antenatal classes?
Yeah, there's some breathing and relaxation techniques for managing labor pain. There's some ways to breathe during labor that can relax you, can soothe you. There's ways even to chants and mantras. We'll get into that maybe later. But and then even during labor, how to effectively push. There's a technique where how you raise your legs, you hold them. If you don't push properly, that baby will never come out. So there's some ways of opening your hips and letting your legs fall that you can practice in the classes. You have to do it sometime before delivery. You can also talk about breastfeeding basics, proper latch techniques to improve breastfeeding success. And that's one of mine. And then also newborn care, where you diapering, bathing. You'd be surprised at what people put on the baby's private parts during diapering, where really just simple powder and a fresh diaper. I've seen, truth be told, motor oil, engine oil poured on a baby's private parts before diapering. And of course, that baby developed all kinds of post-circumcision complications. It was madness. And I had to ask the mother, who told you to put baby oil? She said one woman in a compound said that would help, and she did it. I am still shocked to this day. So some of these techniques you'll learn. It's about the one that really gets me is
breastfeeding and exclusive breastfeeding. But there are a lot of studies that show babies that are exclusively breastfeeding, meaning just breast milk, for at least the first 6 months. I love to extend it through 1 year, but at least the first 6 months, they show that these children make more money in life. They go to better schools. They have higher IQs and intelligence quotient. They have less chronic disease and chronic infections. There's just so many positive benefits to exclusively breastfeeding, but that only happens 30% of the time in Nigeria. So less than 1 out of 3 are exclusively breastfed for the first 6 months, even with all these benefits, because they don't know. Some women think that feeding the formula, I won't name the names of the formula, but we know they have all these formulas out there. Some women think that, the most expensive formula is better than breast milk. And that is just not true. There's nothing better than breast milk. especially in the first 6 months. Absolutely not.
All right, 07000 917. That is the number to call to be a part of the conversation. Send us a text and WhatsApp message on 0703 1756537. Log on to our website www.thebfm917.com. Download the mobile app, the BFM 917. Send your thoughts to our social media platforms, the WFM 917. That is how you can be a part of the conversation for today. 07000 917. Send us a text and WhatsApp message on 0703 1756537. All right, Dr. Abiola. I know we've been talking about the mother, we've been talking about the expectant mother and what have you, but we've not really spoken about the role of the partners, the family members, and what have you. So how can partners and family members help pregnant women or support pregnant women to attend these classes? Okay, because these classes are attended by pregnant women. So what is the role of the partner and the other family members in supporting the pregnant women to attend these classes and help them in their pregnancy journey?
Well, just like in the States, especially in ROA, we allow anybody, if you want to come with your husband, come with your partner, you're free to come to those classes. It's just because partners and family members gain a deeper understanding of the pregnancy process, and going through it together and being supportive, they can learn practical ways to offer physical support and, more importantly, at times, emotional support. And this may include, assisting with daily tasks. I've seen husbands that didn't know that if this is a high-risk pregnancy, your wife is not supposed to be carrying load up and down stairs and mopping and sweeping with force. These are the kind of things that can show when we talk about physical support. In Nigeria, where family involvement is more common, the antenatal classes promote a supportive environment for the whole family. And I like research and evidence. The research shows that when the partner is involved, mothers experience reduced anxiety and higher rates of birth satisfaction, which you have to understand the mother and the baby are obviously tied together. If the mother feels less anxiety, the baby is also going to feel less anxiety. Birth satisfaction, birth outcomes are usually much better, both mentally and physically.
All right, 07000 917. That is the number to call to be a part of the conversation. Send us a text and WhatsApp message on 0703 1756537. Log into our website www.thebfm917.com. Download the mobile app, the BFM 917. Send your thoughts to our social media platform, WFM 917. All right, Dr. Abiola, are there different types of antenatal classes? And if so, what are the differences?
For us, we don't have, in our hospital, we typically try and cater to the entire crowd, because in that crowd you may have first-timers, second-timers, family members, etc. But in some areas, especially in the States, I saw there were different types. They have some antenatal classes that are focused on solely nutrition, some that are focused solely on exercise. In the States, we have some where people will come just to do yoga and stretches and whatnot, and they're not really in a lecture environment. But here, we try to combine all of them together. But it's possible to have some on exercise, some on nutrition, some are just in the so-called Lamaze classes, where it's just on labor. So how to breathe, how to manage stress, how to hold your legs, and that's the sole focus of that class. Some of the reasoning behind having different classes is you have different people attend. So of course the pregnant woman attends all of them, but For example, the breathing classes for labor, if your husband is going to be there during the delivery, he should attend so he knows how to help during delivery. If it's going to be your mother or grandmother, she can also attend so she knows how to help during delivery. And then you get some specific things that are specific to that healthcare facility. You know, some may want you to hold your knees, hold your hands behind your knees. Some may want you to put on top of your knees. All those kind of little nuances. It's best to get them out of the way at the beginning rather than trying to do this in the middle of labor when tensions are high.
All right, thank you very much for your thoughts on the show for today. 07000 917 917. We're gradually tilting to the end of the program for today. Dr. Abiola, I would like to ask you, I know for antenatal classes, due to, what am I going to call it now? Due to the advent of technology, we now have antenatal classes online. So my question is, would you say that antenatal classes online are as effective as in-person classes?
Well, it depends on how it's done. I would never tell somebody not to do online. You know, if you online or nothing at all, do it online because you need that information. The benefit of having it in person is that you just get that emotional support from the other mothers. When I walk into the room when we're having our classes here and it's full of, maybe 30 women in there, I can feel the energy, right? And when one woman puts her hands up and says, hey, I'm throwing up every morning, for the past 1 week, you'll just hear the collective empathy in the room. Like, oh, yeah, me too. Oh, yeah, me too. And then somebody may say, hey, I've been using garlic. Is that safe? And now we can now talk about garlic. We can now talk about honey and lemon and etc. If it's done online, there's a chance that you may not have that same interaction. So go to the classes any way you can, but if you can attend at least some of them in person, you may get some additional benefit.
All right, 07000 917 917, 07000 917 917. Well, I think we've established a great conversation on the show today. Okay, so just before we wrap up on the show this morning, Dr. Abiola, I would like to ask you, how can expectant mothers find and choose the right antenatal class for their needs?
Well, what we do is we provide information, like we post it on social media and such. If you're pregnant, let's say by at least 12 weeks, you should register that child or register that pregnancy with your healthcare facility. As soon as you register, you should not ask about antenatal classes. You're going to give out my social media. Just we allow people, even that are not registered with us, to attend classes as long as we know who they are. And we can point people in the right direction. But the simplest way is make sure that you register your pregnancy by at least 12 weeks and start then finding out the times and locations. Like we do ours every other Saturday, and people have different schedules, so you should find the schedule. And then the other thing is that if you can't make the classes, find a way. If you can't make a particular class, find a way to get that. We have a way where you can ask a doctor to take you through it, as through an appointment, but you'd have to make that request. So it's best not just to not skip them at all. I recommend women try to attend at least one a month.
All right, at least once per month. Okay, so thank you very much. As we wrap up on the show this morning, what would be your advice to pregnant women listening to the conversation today?
Number one, try not to take your information from random internet sources or random people in the environment. Ignorance is a number one cause of sickness and death in Nigeria. Ignorance and refusal to get information from the proper source. That's why I like what WFM is doing and what I try and do every day. So get your information from a proper source. And just because you're feeling fine or you think the baby's going fine, do not miss your regular checkups. So your well checkups usually are about every month. up until the third trimester, they then become every 2 weeks, and then closer to delivery, they become every week. Do not miss those. Don't miss those appointments. It's not all about just doing a scan every time. Sometimes just going there, the doctor may ask you questions, or and they see some of these early warning signs. So get treatment early, get information early, and get it from the right source. Those are my best advice.
All right, thank you very, very much for your thoughts on the show for today, Dr. Abiola. Do enjoy the rest of your day.
Thank you very much. Thank you. Have a good weekend.
All right. Well, there you have it from Dr. Abiola Ajayi, the MD of ROA Specialist Hospital, and he has been able to advise us on antenatal classes, early education for a healthier pregnancy journey. So if you would like to reach out to Dr. Abiola of ROA Specialist Hospital, you can reach out to him on 0913 579 5108 0913 579 5108. Okay. All right, and then you can also reach out to Dr. Abiola on any of his social media pages. Facebook, it is ROA Specialist Hospital. Instagram, it is ROA Specialist Hospital. YouTube, it is ROA Hospital. Twitter, it is ROA Hospital. Or better still, visit www.theroahospital.com. Thank you very much for being a part of the conversation. Remember that Radio Doctor on Women Radio 91.7 is Nigeria's first specialized radio health program, broadcast Mondays through to Fridays, 10 a.m. So join us again on Monday as we bring you a fresh edition of Radio Doctor at 10 a.m. Many thanks to the producer, Aisha Sani, and the executive producer, Tom Okiwale Shonaya. My name is Blessing Agbe.